So we are going to talk about antiemetics, drugs that are used to reduce or prevent vomiting, used to treat vomiting. So these are the general classification of antiemetics. We have the centrally acting dopamine 2 blocker, such as metoclopramide and promethazine. And then we have the serotonin 3 blocker, such as ondansetron. And then we have the histamine 1 blocker or histamine 1 antagonist, such as cyclizine. And then we have the muscarinic blocker, such as hyoscine. And then neurokinin blocker, aprepitant. And we have the cannabinoid antagonist, dronabinol, and also nebilon. So if you paid attention to the list, then you would have noticed that all of these are antagonists: D2 antagonist, serotonin 3 antagonist, histamine 1 antagonist, muscarinic antagonist, neurokinin antagonist. But then there is one agonist, which is the cannabinoid agonist. So the D2 blockers and the serotonin 3 blockers, and also the neurokinin blocker and the cannabinoid agonist, they are effective for cytotoxic drug induced vomiting. And then ondansetron is also again for cytotoxic drug induced. And cyclizine, the histamine 1 blocker, is used for motion sickness, and also hyoscine is used for motion sickness. But of course, this is not the only kind of vomiting that can be used for these drugs. Okay, the drugs can also be used for other kinds of vomiting, but it's most effective against this kind of vomiting for these drugs. Okay, the pair. So again, a quick review of the anatomy of the brain. So you have the brain, and then the lateral ventricles, and then the interventricular foramen, the third ventricle, the cerebral aqueduct, okay, the third ventricle, lateral ventricles, the cerebral aqueduct, and the fourth ventricle, and also the central canal. So this is the lateral view, and this is the anterior view. So going back to that, so we know that's the fourth ventricle there, and then the central canal, this is the cerebellum. So the cerebellum is here, the fourth ventricle is there. So this is called the area postrema, and this is the vomiting center, or the emetic center. So the area postrema surrounds the ventricle, and it is located outside the blood-brain barrier. The vomiting center surrounds the ventricle, and it's located outside the blood-brain barrier. So from another perspective, another view, this is the fourth ventricle, the area postrema, and also we have the nucleus tractus solitarius, or the solitary tract nucleus, which is located adjacent to the area postrema. So we have the higher centers. Here, this is adapted from Goodman and Gilman. So this is the higher centers. So you get sensory input such as pain, smell, and sight. Okay, you see something, you feel pain when you smell something bad, so it triggers the higher centers, and also your memory of certain things, your feeling of fear and dread and anticipation can also trigger the higher centers. And from the higher centers, it can trigger the emetic center in the medulla, or the vomiting center in the medulla, which can lead to vomiting. And then you have the aminoglycosides, for example, or other drugs that can trigger the inner ear, and then the histamine 1 and the muscarinic receptors in the inner ear and in the inner ear will transmit impulses to the cerebellum, and from the cerebellum to the emetic center, which can lead to vomiting. And then you have the blood-borne emetics. Okay, drugs such as opioids and cytotoxic drugs. Okay, so impulses are being transmitted to the chemoreceptor trigger zone, which is the area postrema, which has the receptors, dopamine 2 receptors, serotonin 3 receptors, muscarinic 1 receptors, and also cannabinoid 1 receptors. And this triggering will also lead to the triggering of the emetic center in the medulla, and it can also transmit impulses to the solitary tract nucleus. And in the solitary tract nucleus, you have the dopamine 2, serotonin 3, muscarinic 1, and cannabinoid 1. So these are 4 components that are similar between the area postrema and the solitary tract nucleus. They share these receptors. But in addition to that, the solitary tract nucleus has got the histamine 1 and neurokinin 1 receptor. So from the chemoreceptor trigger zone to the solitary tract nucleus and towards, again, the emetic center, causing vomiting. And then you can also have this triggers the blood-borne emetics, okay, passing through the stomach and small intestine. And also you have the local irritants, bacteria, viruses. Okay, and these, the presence of these in the stomach or small intestine through the serotonin 3 receptors will trigger the vagal and sympathetic efferents. So you have impulses through the vagal and sympathetic efferents, and which can be either go through the chemoreceptor trigger zone in the area postrema, the AP. Okay, so this is the area postrema or the chemoreceptor trigger zone. Again, this is the AP or the area postrema, the chemoreceptor trigger zone. So from the chemoreceptor trigger zone, it can send messages to the emetic center or the medulla, in the medulla. So here, from the area postrema, it can transmit impulses to the vomiting center, which will lead to vomiting. And then we have the pharynx. So if you gag, for example, and through the impulses through the glossopharyngeal and also the trigeminal efferents, transmit impulses to the solitary tract nucleus, and through the receptors in the solitary tract nucleus, the D2, the serotonin 3, the M1, CB1, and also the histamine 1 and also neurokinin 1 receptors, so transmit impulses to the emetic center and cause vomiting. So the serotonin 3 blockers, the common ones are ondansetron, ronisetron, dolasetron, and also palinosetron. So these are some of the commonly used serotonin 3 blockers. So the serotonin 3 receptors are found in the vagal efferents, okay, the 10th cranial nerve, and then also the solitary tract nucleus, or the nucleus tractus solitarius, and also it's found in the area postrema, EP. So the serotonin can be released from the will be released from the enterochromaffin cells of the small intestine in response to chemotherapeutic agents, in response to drugs. Okay, and this may stimulate the vagal efferents via the receptors to start the vomiting reflex. So again, the serotonin 3 here, vagal efferents. So it can pass through either solitary tract nucleus to the vomiting center, or it passes through the area postrema first and then goes to the vomiting center. So if you notice, you might notice that so you have serotonin 3 here, stomach and small intestine, and then here solitary tract nucleus, and also in the area postrema. So the pharmacokinetics, it's extensively metabolized in the liver, okay, and then excreted in the urine. So it's used for chemotherapy-induced nausea, and also nausea secondary to upper abdominal irradiation. Can be also used for hyperemesis of pregnancy. Can be used for post-operative nausea, and it's also useful in delayed emesis, delayed vomiting. So you can find it in tablet, and oral solution, and injection form. So generally speaking, this drug is well tolerated. Okay, this class of drugs are well tolerated. The serotonin 3 antagonists, ondansetron, etc., they are well tolerated. But you might sometimes encounter patients having constipation or diarrhea, headache, and also lightheadedness. So we'll see you in the next slide, on this next presentation, talking about D2 blockers. Okay, thank you.